Hi, everybody. This is Glenn Schumock, and this is Lessons from the Field. As you know, this is a interview series where we interview a guest who has a commitment to pharmacy and pharmaceutical sciences. And today we're featuring Chris Edwards, who is a 2008 graduate from our College of Pharmacy. Dr. Edwards is assistant professor at the University of Arizona College of Pharmacy and also clinical assistant professor in emergency medicine with the College of Medicine there in Arizona. So Chris, welcome. We're going to be asking you a series of questions, and from your answers, I'm sure our guests will get great insight on your career and experience and how that might translate for them, and also for our alumni, friends, and students and others who might be listening. So let's go ahead and get started. So Chris, I was chatting with you before, and we started talking a little bit about what you've done since you left the college. So I'm going to ask you to repeat all that. I'm sorry, but just tell us briefly kind of your career since you left UIC.
Yeah, so UIC really did a great job preparing me for residency. I came to the University of Arizona to do my first year of residency here. While I was here, there was interest and ability in setting up a PGY2 in emergency medicine. So I helped to establish that and was the first resident through that program. After residency, I got hired on as a clinical pharmacist, eventually ended up sort of leading the emergency medicine pharmacy team, taking over the residency program as residency program director. And then after doing clinical pharmacy for about 6 years, I started looking for that next step. I think a lot of us who have been in practice for a while were like, okay, now what? And so I took a job at the time it was Banner University Medical Center, Tucson. I took a job as the clinical pharmacy manager over clinical services at that institution. It was rewarding, but I really missed teaching and doing research in that. So I did that for a couple of years, and then a position opened up with the University of Arizona College of Pharmacy, and it's a split funded position. So now I'm back in the emergency department, practicing pretty much every day, and then also teaching therapeutics to pharmacy students in their second year and doing some research and all kinds of the fun academia type stuff.
Sounds like the best of both worlds for you.
Absolutely.
So, Chris, you obviously you've done a lot since you graduated, and a lot of things to be proud of. Maybe you could just expand on some of your accomplishments and things that you either get the most fulfillment out of, or things you're proudest of in your professional career.
Definitely. So the things that I'm most proud of are really the people that I've helped along the way. So, you know, when I look back at like my proudest accomplishments are seeing former residents go on to start their own residency programs, or, you know, go on and publishing research where I'm like, oh man, that's a really good idea. I'm jealous that they came up with that. So that's where I get the most career satisfaction from. In terms of my own personal accomplishments, you know, I think that just the number of publications that I've had has been, you know, really kind of surprising, and I think has really helped my career. I think a lot of the work that I've done with ASHP has been really rewarding. I was fortunate enough to get involved with ASHP early on, and that has given me a lot of opportunities to network with my colleagues around the country, which has just opened up a number of additional opportunities. Oh, another really awesome thing I was just recently involved with. I was on the initial role delineation study group for the Board of Pharmacy Specialists, and helped to, I guess, gauge the interest in the development of emergency medicine as a specialty. And then I got selected to represent ASHP on the petition developing group that developed a petition to essentially request that BPS recognize emergency medicine as a specialty practice area. That got accepted last year, which was huge. So now I'm excited to see, you know, the development of the exam process for board certification in emergency medicine as a pharmacy specialty. That's probably one of the biggest highlights of my career thus far. I'm really excited that that happened, and I was really honored to be a part of that process.
Oh, excellent, and congratulations on all that.
Thank you.
I'm going to skip one of the questions that we had because I think maybe it fits better here. But given everything that you've done and all of your accomplishments, maybe we could relate that back then to UIC. Was there, how did UIC help you prepare for all of that and make you successful? What was it about your education here that helped with that? So maybe you could go with that first.
Definitely. I'm frequently impressed with the depth of knowledge that I walked away from pharmacy school with. I feel like a lot of the things that I've done with my career have kind of stemmed from, just the connections that I've made over the years. And I think that, having that foundational knowledge to build upon really started with UIC. And I was given a lot of opportunities there to apply the knowledge that I was learning in the classroom. And I think that that kind of helped to prepare me for success as I went out into residency and then started doing work with national organizations and things like that. So really, UIC helped to build that foundation for me. I think that other things that happened during my time at UIC that helped to prepare me for the career path that I've had include a lot of the additional extracurricular things that I participated in as a student. Apologies for that. So, for example, I did a lot of work with Community Health, a clinic that takes care of the underserved population on Chicago's West Side. And when I was doing that, it gave me a lot of opportunities to work closely with medical students and nurses and practicing physicians. And getting that interdisciplinary experience during extracurricular activities really just helped me, I think, to develop the skills necessary to really be part of an interdisciplinary team. I got a lot of that on my clinical rotations, and then I got a lot of that through my extracurricular activities. And so I think by the time I got out into residency, I was already used to working in that space. And so I was able to integrate very quickly on whatever medical service I was put on. And I think that that really helped to prepare me for success.
Well, thank you for that. It's interesting you mentioned community health. We just had an article in our, I think the most recent magazine on what the College of Pharmacy has done with that clinic and all the students that have gone through there and so forth. So it's good to hear that experience helped you along your way. Definitely. Did you also do a rotation in emergency medicine, or did you get interested in that later?
So kind of. I got hired on as part of a grad student grant to do medication histories in the emergency department.
Oh, okay.
Student. And so that was really my first exposure to emergency medicine. And it's funny because acolyte for not doing med histories in the emergency department unless it's going to make a difference for that patient's emergent management. But at the time, I loved it. It was, a reason to put on scrubs and go hang out in the emergency department and kind of experience the chaos. But yeah, when I left UIC, I was honestly like, I think a lot of fourth year pharmacy students kind of experience this as well. But, during my fourth year, I liked everything that I had done. So I was trying to figure out what I wanted to do as a specialty and what my role would be as a clinical pharmacist. And I did an internal medicine rotation with Adam Berja. And at the end of that, I was like, I want to be an internal medicine pharmacist. This is awesome. I could do this every day. And then I went and did an infectious diseases rotation. And I was like, I want to be an ID pharmacist. This is fantastic. And basically every rotation, I really enjoyed it. I could see myself in that setting. And then I didn't do my first formal rotation in emergency medicine until I was at U of A. And then I was like, oh, I get to do a little bit of everything here. This is perfect. So that was really what kind of sealed the deal for me.
Yeah. Wow, that's awesome. So let me go back to the question we skipped then, but now I think it fits in even better at this point because you did your residency, you started practicing, you're in an area that is constantly changing, of course. I mean, look at now we have COVID and all of the, things that we've learned from that, and particularly in the emergency room setting. But how do you keep up? How do you expand your knowledge, stay relevant, and keep that kind of cutting edge expertise in the face of everything that is changing around us in terms of knowledge and practice?
So that's a challenging question, but it's also a fun one to answer. So there are a lot of different ways that I try to use to keep on top of everything that's coming out and going on. In emergency medicine, it's kind of the best description of emergency medicine I've heard is that it's the most fun 5 minutes of everybody else's specialty, right? So you have to have this really broad base of knowledge to build upon. And obviously it's impossible to keep up on the latest advances in, endocrinology and nephrology and all this kind of stuff. So I think really focusing on the things that are specific to your specialty kind of helps you zero in on the journals that are going to be important, zero in on the material that's going to be important, and things like that. Other things that kind of help me to stay, so once I identify like journals that I think are very relevant to my field, I subscribe to the table of contents to be delivered to my email address, and I kind of try to keep track of those. Honestly though, what keeps me on the cutting edge of this stuff is I have a Twitter account that I'm on fairly frequently. And a lot of people, if there's, some really big important paper that just came out, people will be talking about it on Twitter probably that same day. And so that kind of helps me to stay very current on the literature and things that have happened in the field. In addition to that, there are a few sort of aggregator services that I like. I don't know if I should plug them here, but there's a service called Journal Feed that basically takes one article a day, gives you a brief synopsis of it, and tells you why it's relevant to emergency medicine. About 50% of them are medication related, so it's not overly cumbersome to read, but it's another kind of way to keep current. And then honestly, the biggest thing that keeps me current is working with students. So when I have students on rotation, they're frequently asking questions about the newest, greatest things, and it forces me to double check to make sure that my information is still accurate and up to date. And then if I'm really busy, I can always say, why don't you look into that and let me know what you find? And then they can come back to me with all the latest and greatest literature. But honestly, I think the best way to stay current, relevant, and to develop that broad base of knowledge is to be honest with yourself about what you know and what you don't, and be curious enough to fill those gaps in your knowledge if you encounter them. So I see this happen occasionally with students where they don't want to be wrong, so they'll try to bluff their way through, and you never really expose the fact that they don't have that missing piece of the puzzle. And if you can be honest with yourself that piece is missing, and then take active measures to fill that gap in your knowledge base, I think that's where real learning starts, and that's how you can really kind of develop that clinical expertise that we all want to have.
Yeah, wow, that's great advice, not just for students, but for all of us. Chris, you ended with talking about students, which is, I hear a lot from folks like yourself who are clinical faculty or preceptors. And you also said earlier, one of the things that gives you the most satisfaction is seeing your students go off and do well. So this next question is really maybe to expand on that more. I think maybe one of your answers will be the students, but what else is about your position or as a pharmacist do you find, what impact is it that is most pleasurable or achieving that satisfaction and significant for you?
Definitely. Yeah, you hit the nail on the head. It's the students. I really like, I like teaching in the classroom. I think that's important and rewarding and fulfilling, and it's a necessary step. But what really does it for me is when I have a student or a resident on rotation and I can see that aha moment, right? So where it all starts to come together because we're applying the things that they learned didactically, or applying something that we talked about in topic discussion. And then if even better, if it's something where you have like instant gratification, you can see improvement in some measurable outcome for that specific patient that's right in front of you. So like you see somebody get better, you see a patient like actually improve, and you get to see the student or the learner just, have it all come together in their mind. That is the best. That is my favorite thing. And in Arizona, we get to do that pretty frequently. So for example, if I had a situation a few weeks ago where I had a learner with me, we had just talked about envenomations. And one of my favorite things, and you guys in Chicago will be very lucky that you don't have to deal with this, but we have scorpions out here where scorpion envenomation on very young children, it can cause these, really impressive neurologic symptoms. You get flailing of the extremities, they're crying, their tongue looks like a bag of worms. And when you start the antivenom, within 10 or 15 minutes, you see the patient like instantly improve. And I had talked to the student about scorpion antivenom, and you could tell that she was interested in it, but it's kind of hard to just describe all these things. And then a couple of days later, we had a patient come in with a constellation of symptoms. We gave him the antivenom. 10 minutes later, the kid's doing great. Parents are really happy. The student, you can tell, was just like, oh, it all makes sense now. It was like, excellent.
Wow, you just reminded me of why I don't want to live in Arizona.
It's
Spiders
true.
and snakes.
Yeah, spiders, snakes, scorpions, man, we got it all.
Well, that's a great story. Not to mention the the impact on the patient and family member of that intervention. So great. So this has been a lot of fun, Chris. Let me just ask in the time remaining if you have any advice for our students, early graduates, alumni, anyone who might be listening. Maybe a tip for success in work or personal life or anything. Be happy to hear it.
Definitely. So the biggest advice that I could give is two parts: stay curious and stay engaged. So I think it's easy, particularly for like early career professionals, to feel like I got this, and then kind of lose interest in learning more and kind of sticking to that commitment to lifelong learning. But I think that whatever setting you work in, if you're kind of paying attention and again being honest with yourself about whether or not you really understand this, you can always learn something new. Pretty much every shift, you'll come across something where you're like, huh, I've never really heard of that before, or huh, I wonder if that's changed. And that curiosity, I think, it will drive you to continue to learn and grow and just become the best practitioner that you can. And then staying engaged, I think, is critical as well. So there's a lot of opportunities to stay engaged, whether it's through your alumni organizations, your local organizations, national organizations. All of these different organizations are looking for people like you who want to do a little bit more with their career, want to network a little bit more, want to create some new opportunities for yourself. And I would highly encourage people to seek those kinds of things out. You don't need to be you don't need to be an expert in any particular area. You don't need to have 50 publications behind you or anything like that. Really, it's just that willingness to serve, willingness to get involved, and you can really make a difference for your local community, your profession, and yourself. So,
Great advice, Chris. Seems like you've taken your own advice as well, and it's really paid off for you. So this has been fun. Again, thanks for doing it. Anyone who's listening, if you are interested in following up with Chris, we can give you his contact information. Chris, good luck. Hope that someday you'll make it back to Chicago. And when this pandemic is over, maybe we can show you what the old digs look like. We fixed them up a little bit, I think, maybe since you were here, but
excellent.
happy to see you. So,
See you as well.